Did you know? Every year, millions of elderly people around the world lose their lives to preventable diseases. Perhaps without realizing it, our parents or grandparents are also at risk. So, what are the deadly diseases that often affect the elderly? And how can they be prevented? Watch this video so you can protect your loved ones. As we age, our bodies undergo many changes. The immune system weakens, organs don't work as effectively as they used to, and the risk of disease increases dramatically. Unfortunately, many elderly people do not realize the symptoms of diseases until it is too late to get treatment. 1. Heart disease. Heart disease is the leading cause of death in the elderly worldwide. It encompasses a wide range of conditions such as coronary heart disease, heart failure, and arrhythmias. Major risk factors include high blood pressure, hypertension, high cholesterol levels, diabetes, obesity, as well as smoking and physical inactivity. As we age, blood vessels become stiffer and experience plaque buildup, which can impede blood flow to the heart, increasing the risk of a heart attack. Symptoms of heart disease often go unnoticed or are dismissed as normal signs of aging, such as shortness of breath, chest pain, excessive fatigue, and swelling in the legs. However, these symptoms can be red flags that should not be ignored. Therefore, prevention is very important. Seniors are advised to have a healthy diet by reducing their consumption of salt and saturated fats, exercise regularly, such as walking, and have regular medical checkups to detect risks early on. 2. Stroke. Stroke is one of the deadliest diseases that often affects the elderly. It occurs when blood flow to the brain is disrupted, either due to a blockage of a blood vessel, ischemic stroke, or a rupture of a blood vessel in the brain, hemorrhagic stroke. As a result, brain cells are deprived of oxygen and nutrients, which can cause permanent damage or even death if not treated immediately. Risk factors for stroke in the elderly are diverse, including high blood pressure, diabetes, high cholesterol, heart disease, as well as smoking and alcohol consumption. Stroke symptoms often appear suddenly, such as weakness or numbness on one side of the body, difficulty speaking, loss of balance, and visual disturbances. One way to recognize stroke is with the FAST method: face, arms, speech, and time. Seek medical attention immediately. Stroke prevention can be done by keeping blood pressure stable, eating healthy foods, exercising regularly, and avoiding bad habits such as smoking. Elderly people are also advised to regularly check their health with a doctor to detect the risk of stroke early on. 3. Diabetes. Diabetes is a chronic disease that often affects the elderly and can cause various serious complications if not controlled. This disease occurs when blood sugar levels in the body are too high due to impaired production or use of insulin. There are two main types of diabetes, namely type 1 diabetes, which is caused by the body's failure to produce insulin, and type 2 diabetes, which is more common in the elderly and occurs due to insulin resistance, where the body cannot use insulin effectively. The main risk factors for diabetes in the elderly include obesity, physical inactivity, a diet high in sugar and refined carbohydrates, and a family history of diabetes. Symptoms of diabetes often develop slowly, including frequent thirst, frequent urination, fatigue, blurred vision, and wounds that are difficult to heal. If not managed properly, diabetes can lead to serious complications such as kidney failure, blindness, heart disease, and amputation due to nerve damage. To prevent and control diabetes, the elderly are advised to have a healthy diet by limiting the consumption of excess sugar and carbohydrates, exercising regularly, such as walking or gymnastics, and checking blood sugar levels regularly. If already diagnosed, adherence to treatment and regular control to the doctor is very important to prevent further complications. 4. Cancer. Cancer is one of the deadliest diseases that often affects the elderly. It occurs when the body's cells undergo uncontrolled growth, forming tumors that can spread to other organs, metastasis. As we age, the risk of cancer increases due to the accumulation of cell damage and exposure to various risk factors over the years. The most common types of cancer in the elderly are lung cancer, breast cancer, prostate cancer, colorectal cancer, and skin cancer. Risk factors for cancer include unhealthy lifestyles, such as smoking, excessive alcohol consumption, high-fat and low-fiber diets, exposure to harmful chemicals, and genetic factors. Symptoms of cancer often vary depending on the type, but some common signs include unexplained weight loss, prolonged fatigue, persistent pain, skin changes, and the appearance of lumps on the body. Unfortunately, many cases of cancer are only detected at an advanced stage, making treatment more difficult. Cancer prevention can be done by adopting a healthy lifestyle, such as eating nutritious foods high in antioxidants, exercising regularly, avoiding cigarettes and alcohol, and having regular health checks. Early detection is very important, so older people are advised to undergo cancer screening according to the doctor's recommendations, such as mammography for breast cancer or colonoscopy for colon cancer. With the right preventive measures, the risk of cancer can be significantly reduced. 5. Dementia and Alzheimer's dementia is a disorder of brain function that causes a decline in memory, thinking, and communication skills, thus interfering with daily activities. Alzheimer's is the most common type of dementia, accounting for about 60 to 80% of cases. The disease results from damage and death of brain cells, leading to progressive brain shrinkage. Elderly people with Alzheimer's often have difficulty recognizing people nearby, forgetting locations or times, and experiencing behavioral changes such as irritability or confusion. The exact cause of Alzheimer's is not fully understood, but the main risk factors include advanced age, family history of Alzheimer's, high blood pressure, diabetes, and an unhealthy lifestyle. Symptoms develop slowly, starting from mild memory impairment, difficulty finding the right words, to losing the ability to perform simple activities such as eating or dressing yourself. To date, there is no cure for Alzheimer's, but there are ways to slow down its progression. Seniors are encouraged to regularly exercise their brains by reading, playing puzzles, or learning new things. In addition, maintaining a healthy diet with antioxidant-rich foods, exercising regularly, and maintaining active social relationships can also help reduce the risk of dementia. Regular health checkups are essential so that early symptoms can be detected early and treated better. 6. Chronic obstructive pulmonary disease, COPD. Chronic obstructive pulmonary disease, COPD, is a progressive breathing disorder that causes narrowing of the airways, making it difficult for sufferers to breathe. It includes two main conditions: chronic bronchitis, which is inflammation of the bronchial tubes that causes a prolonged cough, and emphysema, which is damage to the air sacs in the lungs that reduces their capacity to absorb oxygen. The main cause of COPD is long-term exposure to cigarette smoke, either as an active or passive smoker. Other factors that may increase the risk are exposure to air pollution, dust, chemicals, as well as a history of recurrent lung infections from a young age. Symptoms of COPD develop slowly, often starting with a chronic cough, excessive sputum production, shortness of breath, and fatigue. Over time, the condition can worsen to the point where it becomes difficult to breathe even at rest. Since COPD is incurable, prevention is the best course of action. Quitting smoking is the most effective way to slow the progression of the disease. In addition, keeping the surrounding air clean, wearing a mask when exposed to pollution or chemicals, and doing breathing exercises can help reduce symptoms. Once diagnosed, treatment with inhalers, oxygen therapy, or pulmonary rehabilitation can help improve quality of life. Regular checkups with your doctor are highly recommended to control disease progression and prevent serious complications. 7. Osteoporosis. Osteoporosis is a condition in which the density and quality of bones decrease, making them brittle and more prone to fracture. This disease often affects the elderly, especially women after menopause, due to a decrease in the hormone estrogen, which plays a role in maintaining bone density. However, men are also at risk of osteoporosis, especially if they have an unhealthy lifestyle or a family history of the condition. Risk factors for osteoporosis include a lack of calcium and vitamin D intake, lack of physical activity, smoking, excessive alcohol consumption, and long-term use of certain medications such as corticosteroids. Symptoms of osteoporosis are often not felt until a fracture occurs, which usually occurs in the hip, spine, and wrist area. In some cases, osteoporosis also causes a hunched posture, chronic back pain, and reduced height due to spinal loss. To prevent osteoporosis, elderly people are advised to eat calcium-rich foods such as milk, cheese, green vegetables, and soft-shelled fish. Exposure to morning sunlight helps the body produce vitamin D, which is important for calcium absorption. In addition, exercise such as walking, yoga, or light strength training can also help maintain bone density. If needed, your doctor may recommend calcium supplements and medications to slow down bone loss. With a healthy lifestyle and early detection, osteoporosis can be prevented and controlled to keep the elderly active and independent. While diseases affecting the elderly sound alarming, the good news is that many of them can be prevented or controlled with a healthy lifestyle and proper care. Here are the important steps that can be taken to keep the elderly healthy and reduce the risk of developing deadly diseases. Implement a healthy and nutritionally balanced diet. Adequate nutritional intake is very important to maintain endurance and prevent various diseases. Elderly people are encouraged to eat fiber-rich foods such as vegetables, fruits, and whole grains to maintain digestion and control blood sugar levels. Consumption of protein from fish, skinless chicken, and beans also helps maintain muscle mass. Also, limit your consumption of sugar, salt, and saturated fat to reduce the risk of diabetes, hypertension, and heart disease. If necessary, consult a doctor or nutritionist to get a diet that suits the health conditions of the elderly. Exercise routinely according to body ability. Regular physical activity can help maintain ideal body weight, strengthen the heart, improve balance, and reduce the risk of osteoporosis. Elderly people are advised to do light exercise such as walking, elderly gymnastics, yoga, or swimming for at least 30 minutes every day. Light strength training is also important to maintain muscle mass and reduce the risk of falls that can be fatal. If you have certain health conditions, be sure to consult your doctor before starting an exercise program. Avoiding cigarettes and alcohol. Smoking and alcohol consumption are major risk factors for many deadly diseases, including chronic obstructive pulmonary disease, COPD, cancer, and heart disease. Quitting smoking not only improves quality of life, but also extends life expectancy. If it is difficult to quit, seniors can seek help from a doctor or rehabilitation program to gradually reduce addiction. Maintain ideal weight. Obesity or being overweight increases the risk of diabetes, heart disease, and high blood pressure. Conversely, being underweight can also lead to a weakened immune system and increase the risk of osteoporosis. Therefore, maintaining weight within a healthy range with a good diet and regular physical activity is highly recommended. The elderly can also check their weight regularly and consult a doctor if there are unnatural drastic changes. Routine health checks to the doctor. Regular health checks are very important to detect disease early. Elderly people are encouraged to check blood pressure, blood sugar levels, cholesterol, and cancer screening according to the doctor's recommendations. If you already have chronic diseases such as diabetes or hypertension, regular control and adherence to treatment are needed to prevent serious complications. Maintain mental and social health. In addition to physical health, mental health is also very important for the elderly. Loneliness and excessive stress can increase the risk of dementia, depression, and various other chronic diseases. Therefore, maintaining social relationships with family and friends, participating in community activities, and exercising the brain by reading or playing puzzles can help maintain mental health. If you experience signs of depression or cognitive impairment, consult a doctor immediately to get the right help. By implementing the steps above, older adults can lead healthier, happier, and more active lives. Don't wait until illness strikes. Start small changes now for a better future. Health in old age is highly dependent on the lifestyle you lead from an early age. Don't let your loved ones fall victim to this deadly disease. Share this video so that more people realize the importance of maintaining health from now on. Don't forget to like, share, and subscribe so you don't miss out on other health information. See you in the next video.